family of a vulnerable man who died in hospital after being fed jelly are calling for changes in care.
Edward Cassin, who had difficulties swallowing, died in Milton Keynes Hospital 2 years ago. Staff had repeatedly fed him food that had been flagged as a danger to him, a mistake which led to a fatal case of pneumonia.
Well, Mr Cassin's sisters say hospitals must get better at caring for patients with learning disabilities. Matthew Hudson reports.
Look at that. This is my favourite picture of me and Ed ever.
To lose your brother is hard. To know he didn't need to die is far harder. Edward Eddie Cassin had learning difficulties and complex medical needs. During frequent periods in hospital, he had very specific dietary requirements, but in June 2023, they were ignored.
I feel devastated that my brother died when he shouldn't have died. He had a brighter future, and if things had been done properly that day, he might still be here and enjoying life.
Eddie, who was 66, had problems breathing and swallowing. At the time of his death at Milton Keynes Hospital, he was developing undiagnosed pneumonia. This was made worse after he was fed jelly. His condition worsened and he died a few days later. The coroner at Eddie's inquest recorded neglect as a contributing factor and later wrote, "Jelly was specifically and repeatedly highlighted as a food he should not be given. Despite this, there was evidence of repeated administration of jelly through his stay, including on June the 24th. This was a food that was specifically excluded by the dietetic service. Their advice was not followed."
Now the Preventing Future Deaths report's been issued.
The charity MenCap and lawyer Karen Hayes have been supporting the family.
No one read the notes. The clinicians didn't bother to read them. The nursing staff, including a very senior staff nurse, didn't bother to make sure they knew what was going on either.
And Eddie died?
Eddie died.
In fact, over the past 3 years, 4 vulnerable or frail patients, including Eddie, have died at Milton Keynes Hospital in cases involving respiration and food.
How many times has someone got to die before you learn a lesson or you make changes to look after people, especially people with learning disabilities who have a different criteria than a normal patient? To me, they didn't take that into consideration as well.
Eddie Cassin was one of 11 children and the first of them to die. He was adored by his large but close-knit family. They believe the government's much heralded 10-year plan for the NHS must help ensure elderly and vulnerable patients are made safer in our hospitals. Matthew Hudson, ITV News, Newport Pagnell.
Well, in a statement, Milton Keynes University Hospital said they are profoundly sorry for the failings in Mr Cassin's care. They added an external review looked into Mr Cassin's death and a small number of other incidents of choking and aspiration. It found no serious or systemic issues and made minor recommendations for improvement, which have now been put in place.